It's that time again. Your dental appointment is coming up, but this time you're a little more nervous than normal. Your last few dental appointments had to be pushed back due to unforeseen circumstances, and by past few, you mean you can't even remember the last time you stepped foot in a dental office. If you're going to the dentist for the first time in a while, you probably have one major worry: getting a filling. You may even have a weird feeling in your mouth and think that you need one. It's the thing that most people hate hearing in the dental chair. But what could happen if you avoid getting that filling? Why do people need fillings in the first place? The main reason you'll hear is because of a cavity. You get a cavity when the bacteria in your mouth feast on the carbohydrates in your diet. If these bacteria and food particles aren't cleaned away with regular brushing and flossing, eventually they will secrete acids that destroy your teeth and form a hole, otherwise known as a cavity. If you have a cavity and it isn't hurting you right now, eventually it will. Cavities tend to start off very small and may even be reversible when they're first forming, but once they get big enough, they'll have a much easier time of spreading. That's because the layer under your enamel, also known as your dentin, is a lot weaker than your enamel. To put it into perspective, your enamel will start to wear down at a pH of about 5.5, while your dentin wears down at a pH of about 6.5, meaning your enamel can tolerate these acids to some extent, but your dentin can't. Meanwhile, these bacteria love living in these acidic environments. So your cavity might seem like a small hole on the outside, but could be a lot bigger once your tooth is opened up. This is why it's important to remove that decay and place a filling to keep that tooth clean and prevent further damage. Once the decay spreads to your dentin, your tooth will most likely start to hurt, since it's getting closer to that nerve in the center of your tooth. But let's say you're pretty tough and the pain doesn't bother you so much. Eventually, the cavity will spread to the nerve that supplies your tooth. At this point, the tooth will definitely hurt a lot. And the only way to save the tooth would be a root canal. If you don't have the money for that, your only other option is an extraction, and you'll probably want this fixed as soon as possible. Continue to leave this untreated, and the infection could spread down the canals of your roots. At the bottom of your root, there's a tiny hole, which is how the tooth is supplied by blood vessels and nutrients. This hole would act as a passageway for the infection to spread to the bones that surround your teeth. At this point, the nerve in your tooth might be dead, but that doesn't mean you won't feel any pain. Since the area around your tooth is infected, you'll still feel a lot of pain, especially during biting. You may even see some swelling around that tooth. If you didn't start to worry already, now is the time. This swelling won't go away without any treatment, and you may even have to go to the hospital. If this abscess isn't drained, it could spread to other areas in your head and neck, possibly cutting off your breathing or even spreading to your brain. Saving that tooth would be the least of your concerns. Now, you might still be able to save that tooth with the root canal, but if that cavity ate away at too much of that tooth structure, you're out of luck, and the only option you have left is to pull that tooth. The bottom line is, don't push off your dental treatment. Your teeth may feel fine, but things can get pretty out of hand if left untreated. It's always better to treat something early than to wait until it's too late, resulting in more pain and more cash out of your pocket. What do you think about fillings? Have a burning question you'd like us to answer? Let us know in the comment section below. As always, thank you for watching, and be sure to like this video and subscribe to our channel if you haven't already, and we'll see you in the next video.